to think about people and how they perceive climate change and how we talk about it and react to it and integrate it into our life's mission.
If I look at the issue of climate change, to me it represents the most significant public health challenge of our time.
There is a climate silence in America today. By that I mean most Americans tell us in response to our surveys that they don't talk about climate change. They rarely see climate change discussed in the news.
Cities are bearing the brunt of many of the impacts of climate change, especially coastal storms, heat waves, and air pollution. And so it seems like action is just happening more at the city level, which is really encouraging.
Cities are perfectly positioned to address the climate crisis for 2 or 3 reasons. The first is that's where the people are. We're increasingly an urban world. The second is that's where the emissions are. And the third is that city governments, by their nature, are very practical. You've got mayors and city governments that are used to taking real actions. It's a perfect combination.
I would say that a great first step would be just to get cities where Boston are now. So having a full-time staff working on climate change, having a climate action plan, having a vulnerability assessment. Taking those first steps are things that are really, really important and that Boston's proud to be able to say that we've done. But then we want to make sure that we help other cities get to that point so that they can succeed as well.
We often say that the Pulitzer Center is about finding people where they are, engaging them directly, and helping them see the connections between big global issues and their daily lives. In the case of climate change in cities, that's both a huge opportunity and an urgent necessity.
The unfortunate thing about how climate change shows up right now, though, in our communities is that it has a disproportionate impact on some people, way more than others. So it's not just people who may have underlying health conditions, but it's poor people and people of color who already live in communities that have had an underinvestment in infrastructure and actually have way more polluting industries within their neighborhoods than our wealthier communities. So we do need to get to the neighborhood level. So we're trying to we're struggling with doing these neighborhood profiles, but instead of issuing sort of our reports, most of the data that we're collecting at the health department actually comes from people who live in our communities. It's really their information.
As a journalist at the New York Times, one of the things I want to do is to surprise people and to teach them things that they didn't know before. So one way to do that is to lean on the data, to bring new data and new ways to share our stories.
There are substantive issues that underlie these climate change problems that you can't ignore them as a journalist. You have to be willing to read the science. You have to be willing to read the policy documents, to be the carriers of that information, to simplify it, to get it correct, to write it in accessible ways.
It's really hard to think of a more pressing issue than the issue of climate and the changes in the climate and how those are going to affect the health of populations. Our job really is to generate the science, generate understanding, and then make sure we are part of solutions towards creating a healthier world.
We're facing a challenge for public health that is very linked to climate in terms of the challenges to health from extreme weather, vectors, as well as the challenges to public health from using unsustainable policies like energy policies or transportation policies, which have create direct risks to health.
People can see it. They really viscerally react to kids with asthma, knowing that we don't need to have air pollution. Air pollution is killing billions of people prematurely. We have to address that problem. And the exciting thing is, if we do address that problem, you drive the carbon pollution down that fuels climate change. That's why public health and climate are one and the same challenge, and the solutions for one can really grab the solutions for the other. That's where the opportunity comes in.